This is Living Healthy with Jackie Bell, the show with the information on health that you need to know from people you can trust. Brought to you by The Woman in You.
Hi, welcome to Living Healthy. I'm your host, Jackie Bell. Tonight our topic is holistic pediatric care. We've invited Dr. Daniel Beilin from the San Francisco Bay Area to join us. Welcome, Dr. Dan.
It's great to be here.
Thank you for coming all this way.
Yeah, you're welcome.
Dr. Daniel Beilin has practiced complementary medicine for 23 years and has a neurophysiology, gastroenterology, as well as herbal pharmacology background. He's internationally recognized for his contributions to early detection and causal identification of disease by cutting-edge European methods. From his website, fortifyhealth.com, he specializes in providing treatments to individuals using energetic as well as orthodox methods. Dr. Beilin also lectures for famous personalities such as Anthony Robbins, Burton Goldberg, Dr. William Ray, Dr. Hans Nieper, and Dr. Jonathan Wright. Dr. Beilin also testified before our U.S. Congress regarding women's cancers in 2002, and he has a patent pending on a new type of medical thermography device after having passed a previously existing device through the FDA and successfully marketing that device to over 150 physicians. Tonight our topic is on holistic pediatrics. We as parents have had to deal with how to take care of our children's health. Everything from vaccines to occasional fevers and earaches to chronic fevers and earaches, anything from bronchitis to serious things like asthma, eczema, allergies, and even behavioral problems. And Dr. Beilin, thank you so much for everything that you have to share with us from your clinical experience. So could you just start by explaining your approach to holistic pediatrics?
Well, for instance, I just in the last couple of months had an 18-month-old little boy. Parents brought him in. He was having chronic infections and
ear infections?
Ear infections and unceasing small fevers and continuous nose running and keeping him up all night. So every hour he was crying. The parents didn't know what to do. They brought him several times into the even hospital, ER, and pediatric wards. They said basically, we can treat him with antibiotics, but it's viral. So they really had no answers where they were going. So what I did is I looked at what he's eating, what they feed him. That's the most important thing with infants and children, because their GI tracts are the cardinal point of the entire body at those young ages. So if you can correct the intestines on children, you've got 90% of your problems taken care of. So it turns out they were feeding him cow milk. He hadn't been breastfed. They were also feeding him some foods that contain dairy, other dairy, and they were also giving him some things that had sugar in them, although that's not as important as the dairy problem. So the job was easy. We took him off of all dairy. I had the mother go out and get some raw colostrum that you can now get in like either community, local environments, or you can get them at health food stores. You can get raw colostrum, which is an immune stimulant that comes from, really, it should be coming from the mother's milk. And I used a little bit of herbal drops with elderberry extract. And elderberry is sweet tasting. It's in a glycerin base, so the little boy could take it and enjoy it, as well as giving some homeopathic remedies, which I'll talk about a little bit later in the show. After 2 weeks, he had started sleeping 3, 4, even 5 hours a night.
Wow.
The amount of discharge, nasal and otherwise, went down by about 80%. And they were finally being educated about what is really causing, this little boy's problem. They brought him back 2 to 3 weeks later, and he was about 100% improved. He wasn't whiny, he wasn't crying, he was sleeping through, you know, at least 4 or 5 hours at that age. It's fantastic. And this gives you an idea of where to start. In medical school, they don't teach food reactivities. They don't teach about the, well, now they're just beginning to teach about how important breastfeeding is, because if you remember in the 50s and 60s, they had Dr. Spock was the official, you know, expert on children. He said absolutely not, no breastfeeding, and he, you know, basically ruined immune systems so that a lot of those kids developed allergies later on, and they developed, you know, immune dysfunctions. So, you know, that's, you know, one major aspect of children when they're young is to do that.
So the holistic approach doesn't involve just treating the symptom with an antibiotic or a medicine. It would be looking at some of the root causes, which in this case was an intestinal issue.
Right. The antibiotics are, you know, of course, most necessary in very high fevers, where a high fever can actually break through the blood-brain barrier and cause a real meningitis, which, you know, can kill children. So we have to draw a line somewhere in holistic medicine. What can we treat, and what you know, do we have to refer on to orthodox medicine and emergency room? So
what do you advise for fevers?
Well, it depends how high a fever is. If a fever is a normal 101, 100, 102 even, we look at that as actually a good thing. It's providing a system, it's a natural thing to have a fever. It's an indication of the strength of the immune system is intact. Because babies who have really weak immune systems, and they might be born with immune deficits of different kinds, they don't get a high fever. Now, high fever is the body's own healing system, its own healing mechanism for burning out and killing bacteria and virus. You know, many diseases are very much helped by hyperthermia, by heating the whole body, which does do some facilitation of the immune system. It increases circulation, it mobilizes white cells, and it also is harmless to healthy tissue. So heat is a very good treatment in many diseases. So we like fevers, but they have to be controlled. If they get 103, 104, then we start to want to use some possibly Tylenol or to be able to control it. If it still maintains itself, which, you know, can happen, then we go to antibiotics.
Okay. And what about ear infections? When a baby has an ear infection or a small child, when do we know when to treat that ourselves and when to seek the advice of a physician?
Well, you know, babies, they, you know, grab their ears and you can kind of tell there's something going on in it. It's not a bad idea to bring them into the pediatrician to see, you know, what's going on, because it could be anything from just a little irritation and even allergy to a full-on, you know, abscess-involved infection.
What's it caused from?
Well, there's, you know, what happens in the mucous membranes of the body is they're controlled by the bacteria in the whole GI tract. You know, all the GI tract, like I said before, with kids, you know, generates up into all the mucous membranes, the sinuses, the ear canals. And so anything wrong in the gut is going to cause problems and inflammations that will pool fluids in the ear canals. So any time in the body when you have inflammation and you have some swelling, then there's not as good drainage to the mucous membranes, and then they start to grow things like bacteria. So this is what happens. Now, so anytime you do anything that will decrease inflammation, like take away allergens or, you know, foods that they're allergic to again, and then you can refacilitate with two things. Bifidus bacteria, it's called Lactobacillus bifidus. You find that at the health food store, and you get a little powder, and sometimes they even have one made for infants. It doesn't really matter. That's the main ingredient.
You just put that in water? Or?
Yeah, you put that, you can even put it in a little applesauce, and then they can have maybe 2 half teaspoons per day. It's a powder usually. And the other thing is cod liver oil. You know, the old cod liver oil, you know, nobody could stand, but now we have companies that make a clear cod liver oil that's healthy, and so those fats actually help generate white blood cells. They help the immune system. Mm-hmm. So that's what I use, and then I use key homeopathic remedies, which are releasing patterns of disease. And the key homeopathic remedies we'll talk about later, but one that I use is either chamomilla, which is made from chamomile originally, or belladonna, which is made from the plant that causes fevers if you have a toxic dose, but in homeopathic dose it actually relieves that heat, and especially for ear infections.
So we're talking about the GI tract affecting the mucosal membranes and the ears and stuff. What about allergies, something that's a little bit more severe? And then also talk about asthma, some things that are just more chronic.
Well, there's two kinds of allergy. One is like kids that have peanut allergies, where they can actually end up with anaphylaxis. You know, their throats close down and they have to go to the hospital. That's true allergy. And then there's food sensitivity, which is a reaction of the body's seeing an antigen or the allergic protein from the food, not being able to really break it down, and it causes this mobilization of histamines by the white cells that start to swell the membranes again, that start the mucous membrane pooling of the fluids to grow things. So what we're talking about right here with parents being able to treat at home or with natural medicine is the second type, which involves food sensitivities. So most allergies, like when I was young, I was, having rashes on my arms so bad that I was scratching them until they would bleed, and then I spent half my childhood picking off the scabs from the arms. My mother thought it was pretty horrible. I kind of liked it, but all the time, they finally figured out that I had an allergy to milk, so they put me on goat milk. And we should talk a little bit about milks, because what are the substitutes that parents can use for food sensitivities? So we have cow milk is bad and goat milk is good. The reason, because goat milk has a smaller protein that's easily assimilated and broken down.
Isn't it more similar also to mother's milk?
Yeah. Mother's milk
as far
also,
as being small protein.
And mother's milk has other immune complexes that are specific for that child. And then soy milk, some kids have allergies to soy milk. So soy milk has a smaller protein, but it's not small enough. And many kids will get the same reaction. So you have to try different things. And what I've found the best is almond milk. It's in most of the stores now, and you look for an organic one, hopefully, because you don't want any pesticide possibility. And so almond milk furnishes good protein for growing and for nourishing all the tissues, and at the same time they're getting the kind of milk that they can substitute fully.
Okay. And so the allergies that are more difficult, that are an actual...
I have one patient who has an allergy to food colorings. So when she was 10, she would actually have small seizures where, the EEG would show a spike, and she would actually have small seizures, and sometimes she would just be kind of dazed on her chair, or sometimes she'd be dancing and kind of like unreachable. So we immediately took her off anything that had any kind of food dye. It's called Feingold's theory. And there's a couple of other theories about different types of elements of foods that can be related to the more complex allergies. It's been found also that in children, the blood-brain barrier, that's the barrier between our circulatory system and the brain, it's not well formed yet. And since the blood-brain barrier is not well formed until about 8 or 9 or 10 years old, more stuff gets through to the brain that causes behavioral problems if they have that sensitivity.
Okay.
Also, if they have the sensitivity, your gut is your second brain, and it actually gives off or produces or synthesizes amino acids that go and furnish neurotransmitters. Okay. And this is the big problem today, is that kids with ADD or kids with behavioral hyperactivity, what's really going on. And I can't tell you how many cases of hyperactivity I've solved with two things. Take all sugar away, and that includes just about every fruit sugar, so they can't even have fruit, and we try that for about a 2 to 3 week period. And then the element or the mineral chromium. Chromium has a regulation effect on the body's own reception to insulin, so it helps control blood sugar in kids. And you can get some drops of chromium, or you get a little tablet and you can crush it and mix it in their food. And you would be surprised in how fast and rapidly the hyperactivity goes down to 0. Well, what might happen to most children nowadays is they will be sent to a pediatric psychiatrist. Then we're in a never-ending one-way street, because then they're starting to use drugs that are like methamphetamine, they're Adderall, you know, they're just one methyl group off from, you know, street speed. It's just used legitimately in our society at this time. And, you know, you've seen interviews with mothers that are in New York, and they're going to the best psychiatrists of the world, and they're giving their kids like 5 psychotropic drugs that are trying to control brain chemistry, when really they have food sensitivities leaking through to change the brain chemistry. They don't exercise. It's very important to exercise, and their diets are not being watched, and they might have sugar-related problems. Also, the food dyes. Why don't psychiatrists, you know, start with natural, you know, ways to treat first before they go to the hard drugs? Doctors don't usually do that. That seems common sense. But what's really happening here in our civilization is that they've lost the common sense part, except for the new movement and getting into a holism.
So it seems like they're treating the behavioral problem as a psychiatric problem instead of dealing with it physiologically and trying to improve the brain.
Well, we're one system that's intercommunicating. So the brain isn't a separate thing way off and, you know, 3 blocks away, and we have to go 3 blocks away and just treat that. Just like in cancer, you can't just treat a tumor and expect the person will get better if the tumor goes away, because the whole body allowed it to form. Right. So the whole body is allowing for that brain chemistry to be off. And I used to be, when I was at UCLA, I was in the Department of Gastroenterology, and we had top professors of gastroenterology every year come for a lecture series called the Brain-Gut Axis. So the brain and gut are like talking to each other more practically than almost every other system except for the endocrine system. So like, you know, and it's been well proved that when you eat, say, when you eat meat, the body knows you have this meat protein, and it sends a message to the brain that tells the pancreas what kind of enzyme to secrete. So, you know, we're dealing with a system that's so well interconnected and so intelligent, and then we need to use it wisely and with common sense and not go straight to drugs.
I want to talk a little bit about vaccines, but can you just touch on asthma first? Well,
asthma is a similar thing, because, you know, that's a vasoconstriction of the bronchi, and it's
is that an allergic sensitivity as well?
Yeah, usually it's coming from allergy, and it's also some adrenal function involved. So the body's own natural cortisols are lower than normal, and that might be influenced by the diet. So what we usually do with asthma with kids is there's specific herbs that help to calm and dilate the bronchi. And so we start with herbs, and we start with the intestines once again, because that's mucous membrane epithelial cells, which are the cells that our skin is made up of, and our whole GI tract and the lungs.
Right.
So we want to always treat in the same kind of cellular line in the body, so we address that. And in all kids, of course, again, it's from the gut. So they may need some inhalants, they may need some real drugs in that case, because, you know, we're dealing with breathing.
Right.
But to use at the same time dietary change away from allergenic foods, which is mostly dairy, and actually I haven't mentioned this yet, but wheat. Wheat in our civilization is different than the wheat that's in Italy. And that's from an older, more ancient grain, so they don't get allergic in Italy, but the rest of the world is mostly allergic to wheat. And that, you know, inflames the gut, it inflames the system again, so they should be all taken off wheat, and there's plenty of substitutes.
Yeah. So let's move right into vaccines. So many of us have to face that choice of whether we want to vaccine our children or not. Even to get into school, you have to vaccinate your children or sign a form taking the liability away from the school. So tell us the pros and cons about vaccines, or what a holistic approach would be.
When I testified before Congress, I met with Dan Burton of the Government Reform Committee, and he's kind of into holistic medicine in a way, and he had a child that supposedly developed Down syndrome from a vaccine right after. And it hasn't been thoroughly proved that the mercury that's a preservative in a lot of vaccines is causing this. That's something that's been disproved in Europe, but it's proved again in other places, so it's still very controversial. Now, the thing about vaccines is that most vaccines have a preservative called squalene, and that comes from shark liver oil. And squalene, when it's injected, causes a breakdown of the connective tissue and the immune system. It should never be injected. It's not supposed to be. You can take squalene in capsule form, and some people believe it helps get rid of some tumors. So the drug companies are using certain things that weren't the best choices that they could be, and so the children are getting all kinds of things beside the vaccine. Another negative effect is most vaccines are inactivated viruses. That means that they've been put into a form that the body can see and develop antibodies and immunity against, but it won't make the person sick. However, it's been proven that years later, when they've been subjected to our society and all the oxidants and all the free radicals and all the poisons in our diets, and their health is beginning to dwindle, especially in our environments now with all the chemicals in our environment, that actually can reactivate the inactive proteins that had come from the vaccine. So then people get derivates or relatives of those things they were supposedly vaccinated against.
What's an example of that?
An example of that is asthma later on in life coming from the pertussis vaccine. So we have a new epidemic in California, I don't know if you have it here, of whooping cough. And you know, it's kind of a controversial thing because the vaccine has decreased the loss of life, and children do die from whooping cough. So it's an ongoing thing, but what you need to do is think about this. Why do you fix something before it's broken? Why do you get a vaccine when you're not sick at all? Well, if you know that you're in the tropics and you know that a certain area has malaria or cholera, then it's probably a good idea. But if you're not like that and you're in our normal society, I mean, why do children get hepatitis vaccines when they go to school? Are they going to, is a 8-year-old going to be exposed to hepatitis? I don't think so. So there are certain vaccines that you need to choose from. Dead polio, not the sugar cube, is probably necessary. Possibly whooping cough if when you go to the doctor, you order a vaccine that has no mercury, and you can do that now. So they have mercury-free, and that's what Dan Burton did, is he made it more possible to have mercury-free vaccines. That's a step in the right direction. But don't forget that some vaccines, they've actually found monkey viruses in. So you really need to do a little research. Tetanus is a good vaccine.
Would that be after you were cut, or to have every 10 years? Or?
No, to have it every 10 or 15 years or so. The new HPV virus, HPV vaccines for, teenage girls is a good idea. Most likely, however, there's a little controversy. I mean, you have to just weigh everything and decide for yourself.
Could you touch on childhood trauma and what's the best way to approach that in a holistic manner?
Well, there are different kinds of trauma, of course, like myself, cesarean section. What do we see? Well, we don't go through the canal, we go straight out. Our first experience is seeing blood and knives and not being attached to the mother and being put in an outside container. So that does, it has been found that it, you get certain characteristics of psychological phenomena later on in life from C-section. Whether traumas have been umbilical cord or in birth, or what the parents' relationship was, and their relationship is extremely important, either prenatally even affecting the cells and affecting the baby, because the baby is picking up a lot of the general hormones that are released by the mother, and that has a lot to do with the relationship. Later on in childhood, of course, there's many traumas that have happened in our civilization and causing problems later on in life. And one of the best technologies or forms of therapy is called somatic experiencing, which actually is a man named Peter Levine's therapy, but it's used by, he's now taught hundreds of practitioners how to look at the nervous system in a specific way and recognize how to regulate the nervous system once again to decrease the effect of trauma. So these are all like in the most futuristic way, along with homeopathy. So homeopathy reaches into trauma. There's the #1 homeopathic for trauma is arnica, which also handles head trauma. Many people who have had head trauma have attention deficit, and it's even been proved that head trauma in life is related to later development of Alzheimer's. Mm-hmm. So, in homeopathy, it's a very interesting technique of using natural substances in microdoses that give information to the body. So, aconite is for shock or any cold that's first coming on. Arnica is for any injury, and now plastic surgeons use that before and after surgery, and they get much better healing rates. Belladonna, we mentioned earlier, for ear infections, and chamomilla. And there's pulsatilla for nose running allergies, pulsatilla. And these things are readily available in health food stores, and they even have pediatric kits that you can buy with very simple explanations about which ones to apply when.
Thank you so much for being on our show. We've covered a wide number of topics, from infections to behavioral disorders. You've really enlightened us in so many ways. Thank you for coming.
Thank you for having me.
You've been watching Living Healthy. My name is Jackie Bell. I'm your host. Join us next time.